Which is worse for your knee pain? Is it osteoarthritis or rheumatoid arthritis? Today, we're going to be talking you through exactly the difference between the two arthritic diseases, how you can manage them, and how you can avoid them causing problems with your knee, which is ultimately going to affect your ability to stay mobile, independent, active, and healthy long term. So my name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, where we help people with chronic back pain and knee pain live a healthier, longer and more independent life, free from painkillers and avoiding risky surgery where we can. So let's start with osteoarthritis. So osteoarthritis is one of the more common arthritic degeneration diseases. It is very typical in people that get older. That's usually the population that we deal with here in the clinic as well. So there's always going to be some sort of arthritic change in the bones. So what does it actually mean? Well, osteoarthritis is wear, tear, degeneration in the joints. It is very common in the knees, the hip, and the spine. We have it mostly in the lumbar spine, which is the lower back, but also we get it in the cervical spine, cervical meaning neck. So how does it happen? Well, primarily it is a wear, tear, degeneration disease where the cartilage in between the joints starts to wear out, and this can then cause problems with inflammation and then bone on bone, degeneration around the bone and the joints, causing pain, stiffness, and achiness. So obviously we're going to talk about how it happens in the knee today, but it can also happen in the hip, the lumbar spine, the cervical spine, but also in the fingers as well. So very typically it affects the end joints of the fingers, and you're going to get some bony nodules around the outside there. This over time can cause stiffness, problems with picking things up, or fine motor control of the fingers. So it's really important if you do start to get that sort of change in the actual bone in the joint, those knobbly bits on the outside, that you start taking some action sooner rather than later. Okay, so here we have a knee joint. This is the knee from the front on here. So can you see this kneecap there? This is the hip bone, we call it the femur, and then you've got the tibia and then the fibula on the outside here. The pink bits, those are the ligaments that surround the knee, and this is the tendon that comes through here, the patella tendon. So what can often happen is we can take a knock to the knee from a sports injury, a fall, a bump, and it can cause the tracking of the knee. So where the knee is like translating force like this, can cause the tracking to be off, so that the kneecap can start to move like this, can cause instability around that area. It usually starts to wear away this medial joint here, medial being inside. So the inside of the knee is the most common place to get osteoarthritis in the knee. Now, this cartilage here is called meniscus. So the meniscus starts to wear away. It's a soft material that's supposed to be just a pad. So if there's more weight going through that side, it's going to cause more pressure on the meniscus. It's going to cause issues in the long run. So we want to make sure that we get that tracking as pure as possible to prevent any osteoarthritic buildup. So how do you know if you've got osteoarthritis in the knee? Well, firstly, it's going to be stiffness and decreased movement. So you may find it difficult to bend the leg like this. You may have issues going up and down the stairs, putting socks on, putting your trousers on, where you have to bend the knee and flex the knee. That's because there's going to be more inflammation in that area. It's going to cause it to get swollen as well. So if there's swelling in that area, that can also indicate some sort of osteoarthritis, as well as a lack of movement. So we call it a decreased range of motion. So when the knee is bending like this, you may not get the whole thing, and that's going to cause a lot of problems with the knee as well. So let me show you a couple of things that you can do to help prevent osteoarthritis, but also if you do have early onset osteoarthritis, try and stop the degradation of it getting worse. You can never reverse any bony change, but it's really important we try and put a stop to it and increase the strength around the knee. Okay, so let me show you this one here. This is very simple to start with. So you can start just by sitting down, and I've got a TheraBand here, my trusty TheraBand. If you haven't got some of these, I would highly recommend you invest in something online on Amazon. Just type in TheraBand, it'll all come out there. So what you can do is you just wrap it around the base of the chair, table leg, find something that's going to be pretty secure. And I'm going to use my right leg here, but you can do it on both legs. So very simply, you want to take a bit of tension onto the TheraBand. So yeah, I've looped this round quite a lot here. So you really want to make sure it's nice and tight on here. And it's simply just trying to kick the foot like this, okay? So a simple kick like this, like so. Anything from 10 to 15 times is perfect, nice and slow. Let me show you from the side. So take the tension like this, and we're just very simply pushing like that. It's going to build stability through this muscle here, the quad muscle, front of the leg. It's going to help the tracking of the knee joint to help take pressure off that knee. Okay, nice. So that's the first one. And then second thing you can do is grab a bolster, pillow like this. You can also roll up a towel as well. And then you just want to put this underneath your knee. So say my right knee is the affected knee. Just going to have that like that. All I'm going to do is I'm literally going to tense my leg up like this. What this is going to do is going to help to gap the joint. It's going to help to stretch through the area. I can also lift my toe in this direction as well. So putting my toes towards my core and relax, and then coming back, hold for 5 seconds, and then relax, and then pulling back in like this. It's going to really help us to flex the joint, open it up, get some extension through there. So flexing like this, that's when you bend the knee. Extension is like that. It's going to close the joint. Flexion is going to open the joint like this. So yeah, 10 times. Again, you do it on both sides, but do it mainly with the affected knee. Okay, I love using the massage gun as well. So the massage gun is great if you're just working on those tissues around the outside of the leg. So very often with a kneecap tracking issue, where it's going to put pressure onto that inside cartilage, there's going to be some imbalance in the muscles. So on the outside of the leg here, this is going to be very tight. This is called your ITB. It's going to be quite weak on the inside. So you want to work on the outside of the leg. You can do it standing, but remember the muscle is going to be tense. So I tend to do it either lying down or just sitting like this and just working up and down, pushing a little bit harder so you feel that the massage gun has to start working a bit harder, and all the way up and down the leg, all the way up to the hip. Don't go on the hip, that's the bony section. Remember, never go on the bony section with the massage gun. You only want to go on muscle and flesh. See, I'm just staggering like this, going little circular movements as well, just helping taking that pressure off. You can go quite hard on this because this muscle is very, very tight in a lot of people. It's called the ITB, so really good to get this one worked out. So as the ITB gets tight, the inside of the leg tends to get weaker. So this is a muscle that if you ever watched any professional cycling, Tour de France is going on at the moment, they have very, very big inside quad muscles because of the stability they have in their knee from where they're generating that torque through the bike. So if it was my right leg, I'd pull my left leg in like this. My right leg goes straight and I turn the foot out like that. And then what you're trying to do is literally pull the leg up and hold, and then come back down like this. So pull the leg up and hold, and then come back down. Pull the leg up and hold, and then come back down. It's called a Muncie knee raise. And the muscle you want to get is the VMO. So vastus medialis obliquus, I believe. I always call it VMO. I'm not sure the Latin name. And that's going to really help to build a lot of tension on the inside of the knee, help that kneecap track properly, take pressure off that inside meniscus to reduce pain, stiffness, give you that range as you go through. I'm going to show you on this side again. So remember, this leg up, turn, and then pulling up like this. Okay? Pulling up like this. There we go. Okay, another one that I love. This is not a strengthening exercise, but more stretch. So again, take the involved leg here, hold onto something, hold onto a chair or the door, and just pull the leg up like this. Now really try and keep your hips square. So this is why you got to hold onto something because my balance isn't very good. So keep your hips square, make sure that your knees are in line, and you're really trying to push your hip forwards. So I'll show you what I mean in a second. You don't want the leg flaring out to the side. This is just a stretch to help take pressure off the front of the leg. Now, from the side. So you see like this, we're not doing this, arching the back. We're literally trying to push this hip forwards. Again, hold on to something. So pushing the hip forwards like that is going to increase the stretch through the front of the hip and through the leg muscle there. So pushing through like this. Not bending like that, not putting the leg all the way back. It's keep the leg fixed, push through the hip, squeeze the buttock, and that's going to help to increase the stretch there. Hold that 30 seconds, repeat 3 times. Okay, so let's move on to rheumatoid arthritis. So in my opinion, rheumatoid arthritis is more severe for the knee. It is much less common than osteoarthritis as it is an autoimmune disease. So what does that mean? Well, it means the body is starting to attack the cells in the cartilage. So essentially the body's defense mechanism views the cartilage cells as foreign. So they think it's like a virus, not the same mechanism, but it says that's not supposed to be there. So it starts attacking it and degenerating it, which causes the cartilage to wear away. So how do you know if you've got rheumatoid arthritis? Well, it is common in the knees. It's very, very common in the joints around here. So around the knuckles, around the first joint on the fingers here as well, around the knuckles and around this bit here. But also you can get it in the neck, you can get it in the hips, the knees, the toes. It's a lot more common. It's more of a systemic arthritis. So rather than just having osteoarthritis in one knee or one hip, rheumatoid tends to go to a lot of joints. You get whole body, systemic kind of stiffness, fatigue, pain, sharp pain in certain joints. There's a lot of bogginess, swelling, redness, where the body's attacking those cells. A lot of inflammation and build up as well. It doesn't just affect the joints, it can also affect other organs, other cells. So it's really important that you do get proper management with this, seeing a rheumatologist. One of the best ways to manage rheumatoid arthritis is by seeing a specialist in this. Chiropractors can help in terms of the movement and getting joints moving, but really you need a specialist rheumatologist to help prescribe some medication potentially to reduce the inflammation and by telling you exactly what you need to do. And if a chiropractor is part of that plan, we're more than happy to help, but please go and see a rheumatologist first. Some of these exercises I showed you for the osteoarthritis may be applicable for the rheumatoid, only if the inflammation is low. Again, you need to check with the rheumatologist first. It is more sinister, it is more severe. Doesn't mean that it can't be managed with the right medication and the right treatment plan, but it is something that needs to be seen with a specialist. Okay, thank you so much for listening today. I really appreciate your time. If you like the video, please hit the like button, subscribe to the channel for our regular updates. And of course, you can grab copies of my best-selling books here in the show notes below. We've got the first one, The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, and How to Transform Your Back is the second edition. See you soon.